Newsfirst studios in Dorset Street in Colombo. Amidst growing concerns for the status of Sri Lanka in terms of the COVID-19 pandemic, we've got here with us the president of the GMOA, Dr. Anuruddha Padeniya, who's of course no stranger to the program. He's been here many times. And let's welcome him tonight. Good evening to you, Doctor.
Good evening.
Thank you very much for coming. The one question that is constantly being asked and debated and discussed is, how did this latest outbreak at a factory happen? First there was claims that there were people from abroad, and the immigration authorities have said that that's not really true, because all the returnees were Sri Lankan citizens or Sri Lankan nationals, and they were under the care of the army at various hotels, so on and so forth. The last flight, the 14-day period, finished on the 6th, so it couldn't have been any of that. In that case, how did this happen?
It's not very clear to date, because it's been now for last 5 days they have been investigating. A lot of teams from the health side, our PHIs are working on it, and then the army, military, intelligence, then the police, and not only that, the administrative system is also functioning to trace where it's the origin. To be honest, it's not clear to date, but what you can understand is now this is a global pandemic. Though we have controlled ourselves, we have to we can't clear our own, because corona is considered as a public health emergency. Mm-hmm. So we have to understand the principles of public health emergency, how it is functioning. So let me take a couple of minutes to explain how it functions. Now, since it is a public health emergency, there are three fractions that to contribute to control it. That is the government, so their commitment, then the healthcare sector, what their commitment and their capacity, and the other component is how public is going to cooperate with this problem. So they have to inform decisions, and informed contribution had to happen. So when you are going to put all these three in place, now as far as the corona is concerned, they consider it as under three phases. The first phase is when the disease was introduced to this country. It was new to all these three groups. So because of that, we had to have aggressive movements. So we call it the hammer and dance theory, where you had to hammer to control the disease. So we all three groups work together to control it. So we had gone through the first phase, and then the third phase is where once you find a vaccine, that you will be free of all this corona vaccine, so the corona epidemic. So that will be globally, we will be relieved. But until that time, we are going to the second phase. The second phase, how they have explained, is the dance phase, where you have fluctuation of patients coming ups and downs. So this is expected, because though we have saved our country from corona point of view, we have to understand there are air travels taking place. And then official quarantine is taking place in two ways. One is in the army quarantine, but the diplomats and other categories are given a choice of home quarantine. But you have to understand, when they come as diplomats, the cooking and certain ancillary facilities are being provided by our locals. So there can be...
I just want to stop you there, if I may. Are you saying that diplomats...
That's one source.
When they come back, they don't have to undergo the usual quarantine, which is through the government or through a hotel? They can have their own private little quarantine?
It's like this now. It's according to the hierarchy of the diplomats they come, and sometimes they are allowed to be at their home quarantine under several precautions. So it's not the same as a usual passenger who comes here.
But there's a bit of a problem there, though, because when there are higher level diplomatic protocol will dictate that the Sri Lankan law doesn't apply within that compound.
Law is in application, but this is kind of understanding in the foreign affairs, and there's a certain amount of, in your point of view, it's a bit of a relaxation. So there had there had been complaints, and even the GMOA has requested the government to be cautious about it. And the third point is the cabin crews who are traveling ups and downs. It's another potential threat that
what happens to a flight crew that arrives into the country?
To be honest with you, we have highlighted this fact, and they are not kept in one place. Sometimes they are allowed to go home, so there are certain lapses from that part. But then again, illegal immigrants and other activities which are under surveillance, but you can have limitations. So I think there can be potential ways of coming this disease. But the problem remains here is, now if you get one patient coming here with one person who can spread viruses, within 1 month that fellow will be able to spread for 512 people. That is the assumption.
That's the sum.
That's the assumption given by Chinese kind of scientific background. So therefore, currently we have about more than 1,000 patients. So just imagine if you calculate in the ID way, if we have 2 people here 1 month ago, there is a potential that they will be spread to this extent. So, and especially this is the place which got affected, is a place where they work together, and there may be limitations of wearing masks and keeping the distance and all these things, and there is a value chain working, supply chain working.
But Dr. Padeniya, I'm concerned at what you've just told us, that diplomats have a different role. Whilst we understand that that rule is all very nice and the Vienna Convention applies and all that, we're talking about a country that is not exactly wealthy. It's always a struggle, even at government level. And that is tantamount to gambling away Sri Lanka's fragile status.
But there are certain other activities adapt to cover it up, like say they do more PCR tests and other things than the usual quarantine kind of practices. So there are certain other value additions in order to match the same kind of compliance and to minimize the spread of the viruses. But then again, the practices may be little bit different with regard to these diplomats. I think that is the foreign relationships and other things, and their dynamicities had to be taken into consideration. So whatever it is, to date, from this had been now going for last 5 days, it's not very clear. Even from the army intelligence, they are using all the technologies, because all these mobile phones and all these things are to track people, and all these activities have been, utilized.
So they still don't know, they can't pinpoint how that particular business with a big workforce, how they came to be infected.
Because in social media there had been certain assumptions which were highlighted and that had been shared by a lot of people.
Unfortunately, some of them, quite a number of those points are untrue.
So that is why those were investigated to some extent. So far nobody could prove exactly where it got originated. So, and but whatever it is, what we have to understand is we were expecting this situation of fluctuation, because we are in the dance phase, but not up to this extent, because if you see the figures, it's a bit alarming, because now if you see, this is the corona, this is patient profiles that had been maintained. You can see from the beginning it had gone up and it had come down like this, and at this point we had the election and we were fairly going free of and suddenly it had come up to a level where it's almost at the highest level compared to what it had been. But still, if we really manage, and if you get the compliance of the kind of our public and healthcare workers are in full action, and we have been assisted by the military and the other intelligence sources and all other facilities, we will be able to control. But more or less, the most important thing here is that how public is going to react to this and to cooperate to us. So if you provide that cooperation, because let me explain how, because people are thinking about total lockdown, and now the basic principle is like this, it's technically decided. Now this is the COVID-19 exit strategy we proposed by the GMOA way back in last April, how it should technically function. Now the principle we have followed, this has been accepted worldwide and been commended. So the basic principle what we thought is, in a surgical theatre, we consider surgical theatre is sterile, whereas outside is contaminated. So in between there is a zone, intermediate zone. So we call it the red zone, green zone and the yellow zone. So therefore, if there are patients according to the criteria matched, there will be green zones. So if you don't have patients and this had gone down to AGA or assistant AGA divisions,
Right.
and then the GS divisions, Gram Sevaka divisions, they had gone up to that level. So if that is, with the surrounding, if it is sterile, you call it a green zone.
Right.
But then if we have patients, it becomes a red zone.
Okay.
In between you have the yellow zone.
Yeah.
So therefore, any zone, if you get patients corona positive, then you become a red zone. So that
Right.
is the principle, this zonal lockdown. So local lockdowns are taking place at the moment. So it's kind of scientifically taking place. But at least what I have to admit the fact is, there is a delay in between suspecting a corona patient and the detection for two reasons. One is there should be adequate viral load to get the corona sensitive PCRs done, and then the PCR testing will have a delay.
Now, several questions, and thank you for your questions by SMS only, please. 0772 300 305. The number ought to come up on your screen. If it doesn't, it's 0772 300 305. Many questions, they say, all that's very good, but you all have failed to find out the source
Correct.
at the factory.
Correct.
Why?
Still it is under investigation because only say about 100 hours gone since its first detection, and for some reason this institution had doctors who had gone, they haven't suspected, so there may be we have to admit the fact there had been a failure.
Now, yes, now that's the point. Now, they say that some of the members of the staff had made use of the in-house medical room, or the sick room, to get treatment for, I call it mundane, but it's not. It's sort of like a cough and a cold, that kind of thing. And so some of the public is saying, look, they should have suspected COVID. But as a medical man yourself,
Correct.
how difficult is it to spot? If I come to you with a cold and a cough and a sniffy nose and a stuck nose, whatever, are you likely to think that I've got COVID?
The corona is a communicable disease, or we call it a contagious disease. So there should be, when that is coming up in kind of big numbers, they should have suspected, that's I think. But we are learning from all these lessons, even the past period we learned from our good practices, and so this is a kind of a good lesson. So we call in medical terms high degree of suspicion. So at least couple of patients should have been taken care and done PCR testing. So possibly for some reason they haven't thought that this is because lack of inputs coming in, because always there should be a contact with the foreigner or who had contact with the patient. So based on that assumption, so possibly they haven't thought that this is corona. But some or other way, at the end, the MOH decided to take samples, and that was proven corona, and that is how
The MOH took the bull by the horns. On that note, we'll go for a short break. Do join us again. We are in conversation with Dr. Anuruddha Padeniya, and we'll see you on the other side of the break.
Newsfirst, Newsline with Faraz, Shauketaly.
And welcome back to Newsline Live. We have a worldwide audience. We have viewers currently from Texas, from Washington, from the United Arab Emirates, from Saudi Arabia, and also from a very special viewer this evening, Mishanti, who's here with us too. Now then, Dr. Anuruddha Padeniya, many questions, and they're all the same. What's the difficulty in identifying? Was that a breakdown in, was it professional negligence? Was it something that's almost unavoidable but was caught in the next process because of the processes you all are practicing?
We can't call it a negligence, because corona is kind of unique and giving us a lot of lessons. Because if you see the WHO, this is the 6th global warning after year 2000.
Yeah.
So none of the other viruses got this kind of attention, for the simple reason that so far most of the viruses which affected the whole world, infected the whole world, had a death rate more than death rate, or we call it the mortality rate more than this. But this is quite unusual. The death rate is around 1 to 2%, and that is also more or less when you have a non-communicable disease. But the spread is very unusual. So that's why I said one person within 30 days will be able to spread to 512 people if you have the normal kind of mobility in a country. So having said that, so the only way is to limit the mobility and to trace the source, as you are very correctly pointing out to it. But for last 5 days, almost all the efforts of intelligence has failed to identify the exact source, how it originated.
Right. So, Dr. Wild, we know that all the intelligent work is being done quite literally over time and intensely so. What's the important lesson to be learned? What advice would you give large employers? Would you say, look, guys, you got to spend some money, keep some PCR kits with you, and do random tests?
Correct. There are few important things that we can do. Now, as I told you, with regard to corona, we are in the second phase, or the dance phase.
Yeah.
So dance phase, you are not expected to be normal.
Right.
Normalcy comes only after the second phase, when you go with the vaccine, and to the third phase.
Yeah.
So we are calling it a new normalcy, and we have published this, how they should act. Now, this is the WHO, Ministry of Health, GMOA, and the other teams, that is the Sri Jawadhanapura Court Municipal Council, we all got together and we have defined the new normalcy. The basic principle here is called DREAM. DREAM is D for distancing, RE for respiratory etiquette, and A for aseptic techniques, and M is for mask. So these are the basic essence that you are supposed to follow. But as you very correctly told, more than from a health point of view, the institution has more responsibilities than that, to ensure that the corona will not get contacted or will not be imported into the
But
site.
every morning, doctor, every morning.
I have another point.
Yes.
The third point is what we are really aiming at, that we have to get community samples, we call it. So randomly, you are supposed to collect samples from all these places. Actually, this was picked up as a part of that activity,
Right.
from a large gathering, potential sources. If you have slums like areas where the mobility can be, because if you get one person, there's a high chance that that will be spread to all these places.
How about doing random checks on the trains, the commuter trains that
Exactly.
arrive into Colombo?
Exactly.
Every morning, I watch this in the morning as we go on Marine Drive. We can see the trains chock-a-block.
Yeah.
Obviously, we need more trains back to back, but they get off and the people disappear into offices and wherever. How about random spot
you are
PCR tests?
You are correct. From all vulnerable sites, like when you are traveling in the train, as you said, then the officers which are, if you are spaced apart and if you are working to this thing, that may be less vulnerable. So as the security calculation of the risk, like that the corona risk had to be calculated, and we have to take random samples, which we are, what your point is very correct.
Do we have enough test kits for all that?
Because they say the current potential is around 4,000 per day.
Yeah.
I think that is fairly adequate if you are really going to do that. And then again, the private sector has their test kits now in operation. Then the military has their own system. Then the airport, they have a separate system.
So private companies are allowed to import PCR kits?
Yeah, because private hospitals are allowed to do. So
Right.
I think there should be arrangement at least to, even when you have some respiratory symptoms, at least couple of patients to be tested and to be very sure. Because what you have to understand is in the private companies, they lost here in this. I mean, if this was tested and if this was prevented, now currently the entire world is in trouble with this corona, whereas we were relieved of it. So we had the opportunity to do a lot of work and to produce more and more goods and to kind of export.
So the principal lesson learnt out of this latest outbreak?
Yeah, the one lesson is individual responsibility, how we are going to work it out.
Yeah.
And as we have pointed out here, then as kind of institutions, how they should function.
Right.
Thirdly, the system, the healthcare system should do random checks at all vulnerable. So there should be calculation of the risk assessment of each corona possibility, and based on that, the random checks had to be kind of strengthened and the weightage had to be given accordingly.
Right. And Is this the message you're sending it out to big business, big employers? Because obviously everybody is facing challenges. The economy is in tatters, not only here, globally. And so there are lots of factors for businesses. But is that what you're doing? Is that what you're advising business to do?
That is only one part of the message. Now what we have to understand is the Lancet journal, that is the world's most popular journal, recently analyzed the deaths, about 500,000 deaths. And what they could find, 500,000 deaths. And what they could find was 96.2 deaths were, corona deaths were, under the platform of non-communicable disease, that is the diabetes and this cholesterol and this cancers, fatty liver, heart diseases and so on and so forth. So therefore the non-communicable diseases are the kind of platform they produce for the corona to come and kill some patients. So therefore even the WHO has advised not only the workers corona testing and their health had to be maintained, especially with regard to whether they are drinking enough water. That is a crucial fact. And WHO very clearly said not to go for these carbonated drinks. So their food, drinks, traditional food is ideal, what they have suggested. Then stopping smoking and the alcohol, and then having kind of home food. So in order to maintain your healthy state, especially with regard to non-communicable disease, is a crucial fact to avoid deaths. Because if you have the deaths, the kind of the attitude towards this corona will be completely different, and then there will be a kind of a real anxiety with regard to corona. So we have to balance both. The obvious challenge is corona, but the ground reality is the platform will be provided by NCD non-communicable diseases, for this communicable disease to come and kill patients. So both challenges have to be taken hand in hand.
How expensive are these PCR test kits?
Roughly it was those days about 10,000, but it varies down to 6,000 like. It all depends on how we are going to do.
Is that the cost, or is that with a margin?
Maybe with a margin, because there are 5 elements in the PCR. The capital cost of the machine is one thing, but more than anything there are consumables like the swab that we are going to take the sample, then the viral transport medium, then the extraction kit and the PCR kit, and then the machine. Now if you are transporting several swabs in one transport medium, like there are kind of multiple test kits, then the cost will go down. So and then when you run the machine, if you with less numbers, if you run the machine versus if you have 60 samples in one go to run the machine, then the cost will vary accordingly. So that is why when the number of patients are higher, then the cost on each test will go down. So it's like it's vary around say 6,000 to 10,000 like.
In a utopian ideal world, would you shut the airport down?
We need not to shut the airport, depending on the capacity of the quarantine. Quarantine in the sense now institutional quarantine. That we will be able to entertain some numbers passengers coming in.
What about how many total ventilators, apart from the normal ICU units, specialized for this thing? How many do you think we have?
Ventilators, of course, it varies around, because we have to use ventilators for other patients as well.
I mean without them.
Yeah, without them around 500, 600 ventilators, and that was expanded to about 800 recently. But some of the ventilators are operating on the operating machines and other things also. So altogether about more than 1,000 ventilators, but mostly for the patients, ICU patients, roughly about 600, 700 ventilators are left.
ICU, but that includes the normal patients, the ordinary.
Other patients, or non-corona patients also.
What about only for corona?
We haven't reserved only for corona.
For infectious diseases?
Infectious diseases, of course.
Do you have 100? Do you have 100?
It depends, because recently now, even today, there are certain hospitals are converted to corona hospitals, so the numbers are going toward this. But when you see the numbers, very few patients ultimately went to ventilators.
Indeed, yes. It isn't as big a concern as it was back in April.
It is not that a concern, but possibly because in the aerated wards
Right.
compared to the air conditioned wards. The Western practice is most of the wards are air conditioned because of their climatic conditions.
So you need the air change.
Our air change is much better because if you take the IDH, the principle there, none of the doctors and healthcare workers hardly got contact from this corona patients. So possibly one reason is when it is aerated and open, then the closed circuits and with the air condition, we may be safer.
Dr. Anuruddha Padeniya, thank you very much and good luck with your continued efforts. There are many more questions, but I have no time. It's now time for the prime time news from News First. In the meantime, have a great evening ahead of you. Safe and wonderful weekend, of course. And as always, God bless you.